This is the, well, if you're listening, you found the link, but this is section 4 of our day on Pillars of the Spiritual Axis and the Ancestral Sinews. So we have about an hour and 15 minutes to go. As a lot of you are out there in cyberspace, I'm going to do some...
I'm not sure if I have audio.
Okay, great. So it looks like the audio passed the test. And yeah, we're on the home stretch here until 5 o'clock. I want to do some more lecture type stuff because I know a lot of you aren't out there able to participate. And first, I was reminded to plug my class tomorrow. I always forget this, but here goes. We're going to do, tomorrow is on listening to the voices of the ancestors and the I Ching. So I Ching, listening to the voices of the ancestors. So we're going to take a look at some of the concepts of ancestry. That was the linking thing here. The I Ching and the Ancestral Sinews, we made them two separate classes because they don't necessarily have a lot to do with each other. But the class should be, we're going to look into the roots of the I Ching, the history of the I Ching, some of this idea of humanity's theories of how it evolves through some auditory hallucinations that made, the I Ching and oracles were kind of preserving a time when humans' consciousness was oriented differently. And then we're going to look at how to build the trigrams and hexagrams, how the 64 play into each other. We're going to look at some sample, hexagrams to get a sense of how hexagrams are built. Sometimes they're pictographic, a little bit how they change into each other. And we're also going to be looking a little bit on things about, the idea of the rituals of nourishing ancestry and what that looks like in ancient China, what they can look like today, and what they can look like in modern life. And then we're going to look into some, we have 3 acupuncture CEUs and 3 CEUs and sort of other continuing development. So if that's a concern, we are getting at least the 3 acupuncture CEUs towards North Carolina. So with that, we'll be talking about some of the 8 extraordinary vessels and their relationship to some of the motifs and images of the I Ching. And then we also look at the I Ching as these section hikes, I like to call them. There's each pair of the I Ching is kind of a yin and yang pair where everything's auspicious and you're gaining, and then you got to take a step back and you're reducing, and it kind of follows that rhythm throughout the whole thing, and you'll have these different themes. And then it kind of culminates in the whole story of the I Ching being like this book about the spiritual development. So we'll kind of look at it as the hero's journey or the soul's journey through the I Ching, and be tying that back to occasionally to ancestry and to the extraordinary vessels. So it should be a lot of fun. I've been teaching on the I Ching once a year for the last few years, and it tends to be interesting. So we had some questions, a little bit more tangible than that were about some of the releases that we just did. So one of them was this one across the arm. This one is small intestine. That's considered one of the small arm taiyan releases, and it really gets kind of that working from. As we saw that picture of Taiyang, it encapsulates the scapula and goes to do 4. So you're working that upper area up into do 4, and you're freeing up the scapula in hopes that, we can free up the neck. But we are freeing up do 4. So part of the theory of the sinews is opening up do 4 and do 14. Do 4 opens all the legs. Do 14 opens up to the neck and the arms. And some of that theoretically is that do 4 is the kidney yang, so this is us and our relationship to the earth and our earthly drives. And then when we get somewhere, we can take in the world. So and this is considered heart yang. We extend our arms out to the world, and then we can experience the world from there. But it also just means opening up the arms and the neck. So before we do things, those are what we want to do to just free up the spine. The other ones we did where the heel goes to the glue. That one isn't, I think specifically that should be for tight quads, but it's not really, some of them are kind of used a little bit just to open up different areas. So that one, even though the quads get recruited, it seems like the general area of recruitment, usually will go up towards some part of the skeleton. So it recruits a little bit of the psoas, recruits a little bit of the glutes. So that seems to be what I experience when I do it, and what the students experience from that. And then the one where the knee is off to the side of the table, that's just one that I was experimenting with, that I was kind of watching on an old video. It's a little bit more of a difficult vector. A lot of people are tight there. And it doesn't seem like the movement that they're pushing against is actually creating a lengthening of the sinew. But what it seems to do is that the glutes get tight and don't allow that area, and so it's the glutes and the hip flexors tend to get involved when you're trying to do that sinew release. So both of those are going to work the glutes and the hip flexors for a little bit. So I hope that answers your questions. Let's see. So I want to talk about different ways of treating. I think we're going to get back on the tables at some point here in the next hour and 15 minutes. But I want to talk about things that you can do that aren't necessarily being demonstrated. So if we are going to, let's say we'll start at the top. SCMs. So a lot of times we might use the ancestral sinews in conjunction with some other aspect of the Yuan Qi, or we could just be thinking of them as regular sinews and we're doing a sinew treatment. But the SCMs, one of the easiest ways to release them is going to be gua sha. So, sometimes you have to position the head a little bit, different than a face cradle, have somebody face up or have, cradle their head so that you can open the SCMs. It can require just a little bit of positioning. It's also good to warn people that if they have discoloration, the SCMs are a little bit visible. So I always want to warn people of that. You have, the window of the sky points. And I would say like Sanjiao 16, it's like LI 17, 18, and we have, SI 17, stomach 9 are all kind of in there. A lot of them end up, landing between the SCMs. So you also have a lot of these trigger points in the SCM seem to be just, working along the belly. It can be a little bit of, positioning the person that way. But needling those windows of the sky points, gua sha, and we saw that some of the ways that we were doing that neck rotation. And sometimes if we are doing the, let's go into the psoas. So the psoas is obviously a deep muscle, even with the spine. So it's kind of at the very core of our body. And the psoas is working kind of antagonistically or complementarily with the glutes and the paraspinals and the rectus abdominis are all kind of creating a lot of this intra-abdominal pressure. And I think some of the easiest access to parts of the iliopsoas, at least, is going to be that GB27, GB28 area. So, needling along those areas is a good access point. And there we also kind of look a little bit at stomach 30, stomach 25, but they're not going to really be necessarily deep enough to access that. So you're kind of using the rectus abdominis to get some energy towards the psoas. We also have the idea that we're going to do a little bit of acupressure with one more thing that I want to show. So there's Qinei Song is internal organ massage, is an abdominal massage that comes from China. It was kind of popularized in Thailand, but it's the idea that just abdominal massage, organ massage. So if you want, massaging the organs is kind of a different level, but getting to the psoas, touch is a good way. So there is, kind of deep sustained touch at like spleen 15, stomach 25 area, and just having the person breathe in, and as they exhale, you sink in deeper. So we'll demonstrate that one. And you can do the same all around like the navel, so like kidney 16. And you don't really have to do the whole, I'll usually do a little bit of a warm up, get them breathing, and then at least release around the navel and release around the psoas, which I think is something that even if you don't do a lot of abdominal massage, you can integrate clinically. And you can wash out some of the inguinal region through, like not the actual inguinal, but above it, like where GB27 is, along the lower abdomen. It's not going to feel good, but there are some times when we're doing that. If you were doing a belt treatment, that could be useful. If you were doing like a liver diversion, that could be an area that you want to release. We have, like with the diaphragm, you can we have a lot of points related to diaphragm. So you have UB17, liver 14, and GB24, all those in the ribs. We have GB22 and 23 in the flanks. And we have, the kidney shoe points are all in those intercostals. Liver 13 at the 11th rib. These are all going to be needles that can be useful for opening the diaphragm. You can also just kind of do intercostal needling. So they're right over the lungs in the intercostal, but you could transverse oblique, following along that intercostal space, and you can sort of piggyback needles. I know there's some people using like transverse oblique 3-inch needles, but a lot of times they're doing that on like athletes who have a lot of flesh there. There are definitely some people where there's no room for doing that level of oblique needling, but you could look for Oshers along there. So you have a lot of options for that. Release the diaphragm, and then you can also, the diaphragm would be right, gua sha, the intercostals. I don't do this on everybody because it just sometimes can be ticklish, it can be painful, it can be a little bit awkward. But some people love it. If they have it, you can kind of get that space in between the intercostals, and you can also be just below the intercostals with the gua sha, and then obviously behind the diaphragm can be useful at points like UB17. So you have those as ways of activating the diaphragm. And sometimes you might want to, if you're trying to do like I guess one of the ones that they're most associated with the 8 extraordinary vessels is the belt channel. So the diamine is going to be one that we talked about with the ancestral sinews. So you have the diamine complex, to me, is going to be like, you have the person, drum, and we always like to a little heart there. So you have this Davao wrapping, and then right at the Ming Men, you have the original belt. So you have these two belts, and then you have the Bao Mai, which goes from the perineum up to like Ren 15. So I look at the Daimai as these orbits, and you will kind of get that in Qigong sometimes where, well, like spinning orbits, that has a lot to do with Shaoyang. And the belt is a wrapping, but you'll see in like the medical Qigong text, like it's a whole cocoon. Everything is just this sort of wrapping around the body. But they've kind of distilled it down to these, the Dabao, the Daimai, and the Baomai, creating this network. And so what we were saying is that the Dabao is another way of freeing the diaphragm, and that is spleen 21 or GB22 and Ren 15 and Do 9. And Do 9 is even with UB17. Do 9 might actually be a diaphragm point. I just haven't used it so much for that. So I'm usually doing a belt channel from the front, so it doesn't come up that way. So you would have that as the Dabao for free of the diaphragm. And then there's this idea that anything that, sometimes things go into the belt channel because they can't be addressed by the heart in real time. So it's anything that sort of is slightly conflicting to the heart is going to go into the basement, into the to be processed later category. And that's going to go down via the bowel line. So the bowel line is literally the uterine vessel, or this reproductive vessel. And it's going in there to be, to be processed by future ancestry, or it's going to be passed off onto your kids. I don't know if I said this today or in this night class I was teaching, but a lot of that is like, so there's this mechanism where the ancestral sinews are kind of shunting everything towards the reproductive organs if the belt channel is starting to be tight, and then it's going to get passed on to another generation. And then I would say if you don't have kids, you're interfering with your own creativity in the world, and from a Jungian perspective, you're just putting material into the basement that is just going to be projected out. So this unexamined material kind of goes into this sort of collective unexamined material. And my opinion is that, like, the metaphor that the world is on fire, I feel like it's because there was just if nobody's taking care of their own little portion of their belt channel Pandora's box, and you just have all this information projected out into the world, and anybody who wants to kind of take advantage of that, all they have to do with their out of control fire elements, strike a match, and we have all this the shadow being kind of a form of coal catches fire real good. So, and I remember reading this Jungian quote. I haven't studied much Carl Jung, but he was like, the most responsible thing you can do for humanity is take care of your own material in the belt channel. So I feel like that's one of the areas that the belt channel represents. And the belt channel also has the GB27, right? So GB27 is wushu, so that's the 5 pivots point. And then there's also GB26 at the navel. And so it's the idea that, why does the belt channel have the ancestral sinews? We talked about how the ancestral sinews relate to reproduction, but it's also like GB26 is called daimai, and it's even with the navel and the Ming men. And then soon as anything gets out of whack, at the hara, then everything sort of like dominoes, and then we start having, it goes right into the pelvis. So 27 and 28 representing, all these anterior, posterior, unevenness, pelvic tilts and things like that. So the belt channel is participating in that sort of distortion of the upright posture from having too much tension or too much damp. A lot of times we think of it as like, the damp from the middle jowl will go down to the lower jowl and weigh up on the kidneys. But you also have this idea that just unprocessed emotion, the damp is actually probably just manifesting as damp, but it didn't require damp to generate this emotion that wasn't being processed. So you have that aspect of the belt channel and their use of opening the diaphragm, and that's kind of the heart kidney. So you're getting the original belt is even with the navel and the kidney, and then you have the heart and the diaphragm up there. We have rectus abdominis is going to be more available than the psoas without having to do extra deep needling. So the rectus abdominis, I feel like anything even with Ren 8, and even like salt moxa, Ren 8, moxa, just kind of warming up warming up that middle jowl. It's going to be good. And so you can have anything on that line. Kidney 16, stomach 25, GB26. It's going to be there. You also have, like I said, Ren 8. And then the trigger points for the rectus abdominis, obviously you can palpate, but they tend to be located up in the area of sort of Ren 14, kidney 21. So you're getting some points, like kidney 21 is a landmark point on the Chan called Yomen, dark gate, a good area for the heart to descend to the kidneys. Kidney 16 is on the Chan because it's, 0.5 from the navel, so you're freeing up the navel. A lot of these reflexes are kind of like retracting into the fetal position from the rectus and the psoas. So salt moxa, needling, kidney 16. If you're being a little bit more postnatal, you could be on the stomach channel, depending on what you palpate. And then you have some of the lower points are going to be just above the pubic symphysis. So you could go all the way to like, stomach 30, Ren 2, or you could be a little bit higher. But we already kind of seeing a pattern here: stomach 30, Ren 2, kidney 21, kidney 16. All those are on the chong. So anything you can do for the rectus abdominis can benefit the chong line. And they talk about these hidden beams in the chong line between the kidney and stomach channel that represent that kind of like these bands related to some heart-kidney issues. And sometimes, it's not always recommended to needle into those, but massage would be a better way to work with those. We've gotten through a bunch of these. Let's go to the soleus. Now, the soleus is another one. I don't tend to gua sha the rectus abdominis, so if you do, that's great. And you can, but we'll look at some manual techniques. And the soleus gua sha can be effective there. We also have we have UB58 is in the calves, so not necessarily the soleus, but that's the low of the bladder channel. So that's called Fei Yong. It's leaping. It's a point associated with fright that was used with the Wei vessels in some historical aspects, even though it's not on either of the Wei vessel channels. There's something about this idea of fright. And to me, why that's a point related to fright is that, of course, we've been learning about all these survival instincts, and so you kind of, when you want to jump out of your skin, you're trying to disassociate. You have these muscles of jumping, like the soleus and the GB30 and stuff, that are trying to get you to. You're trying to leave your body, so you're tightening up in those areas, or you're just trying to run away. And you've tightened up those areas and can't quite come out of it. So the low of the bladder, or you can just, that's a great point for needling. And then kidney 9 we talked about. Kidney 9 is like 5 soon up from kidney 3, and that can be a good access to the soleus, so that you could do deeper needling there. Or if you have other trigger point needling, if you're just going to use Osher points, it's below the gastroc, so it can require a little bit deeper needling and coming in from the side. And we talked about, I think it's just the paraspinal, right? The glutes and the paraspinals. So we have the paraspinals are something that I imagine everybody is pretty familiar with in their practice, right? So you have the shoe points, you have the Wato Jaji, you can do superficial needling. We might take a look at, when we do sinew needling, we tend to be doing very superficial needling that kind of stays at the level of the coolie, just very superficial. So, and sometimes if you want to do that, but you want to needle deeper, you can do transverse oblique. So you can do transverse oblique needling to kind of get more than, just above the Wato or down the bladder shoe points. So if you use a longer needle and just try to keep it oblique. We obviously, gua sha is going to be great for the paraspinals. Cups are going to be great for the paraspinals. Bao liao points are going to be great for the paraspinals. You can gua sha the bao liao as well. And we have, I think that's yeah, so those are a bunch of different aspects of trying to get to the ancestral sinews. I guess the glutes, that's the one that I was thinking about. The glutes, we have, again, the bao liao points. And we're going to have GB30. And so we have like a GB30. A lot of times people will be sore at GB30 and they'll be sore at the attachment of the trochanter. and they'll be sore at the attachment towards the sacrum. So a lot of times if I'm going to needle GB30, I will look for tenderness towards the trochanter, a couple swings away from GB30, and then at the sacrum in that area. There's also an extra point. GB30 is at 2/3 of the way out, 1/3 of the way out has an extra point. So there's a lot going on in there. You also have UB53, you have UB54. We talked about that fourth trajectory of the Dumai. It's a good one for kind of working with the glutes. And you have like glute medius minimus. If you come along, if this is the iliac crest, down to the sacrum here. So if this is the glutes were here, I find those tend to be spots that are kind of tender on most people. And that also seems like these muscles are engaging. And you can still have super strong glutes, let's say you're working out, but the more that these are engaging is a sign that there's a struggle. The glutes are fighting against the hip flexors, and it's kind of coming up into these higher muscles. So those points will be seen, like I've seen those as some of the Kiku Matsumoto releasing of the hips with some 3 points medial to the scapula. But those would be another way of working with that. GB29. So you have a lot of just deeper needling that can access the glutes. And like I said, the glutes and the Baoyao, if you're thinking of somebody in the longer term with the belt channel, I feel like releasing that side of the belt channel can be very helpful. Anybody have any questions? So I'm thinking maybe we will do a little bit of just abdominal table work, and anybody want to be the volunteer? Yeah, please come on up.
You gonna work through the clothes? You want to shirt off?
Keep your shirt off. I don't know. That might lift it, but I don't think
All right, that's fine.
So we call these sometimes like a listening station. So we want to get down here. So this is going to be one of the areas where we come in even with the navel, and we're going to do some deep breathing. I sometimes feel like that can be a little, in your clinical practice, you got to economize your time. So maybe you're going to go there. But I feel like there are some decent warm-ups. So even before we get to some of the breathing, what I like to do is, there's a couple ways of warming up the abdomen. One of them is cat's paw. So cat's paw is a very intuitive move. And if you have a cat,
Yeah, they do that.
you will recognize this. Yeah, making biscuits is what we're doing here. And it kind of, you're right, you're kind of mimicking what you would think, like peristalsis is kind of, it's real slow, and you're just kind of helping everything move. And I like the idea that, Taoist abdominal massage is another way that this has been called. And they talk about not being patients, but being students. So the idea that you're going into it together, this is an exploration. And the idea of not having judgment when we go into the abdomen. So there's like a judgment-free zone. So there's a sense of exploration. And the way I've kind of heard it described is like, what do you have, 28 feet of small intestine or something? A lot. And it's not just small intestine, but it's all these, the lymphatic system is kind of in there, so you have a lot of these lymph vessels. You also have all the blood vessels. You also have all these, nerves in there. So they're all kind of shoved in there together. And I imagine it's not like, from person to person, it probably looks very different, how the intestines just get, small intestine probably looks, and how the nerves are. So you have your maps, the meridians, but what's going on underneath is kind of a bit of a free-for-all with the small intestine. So what we're trying to do is disentangle it, right? So it's kind of like You have the opening thing of the cat's paw, but now you have this, we're gonna go in clockwise fashion, just finger pads, not thumbs. And we're gonna start kind of, well actually we're gonna start here at the navel. So I got ahead of myself. So we're gonna unwind from like, kidney 16. And if you need like a pace, it's like 1, 2, 3, 1, 2, 3, 3. And you're kind of making your way out into larger spirals. So this would be a good warm up for the abdomen. You don't want to be like, hurrying. And the reason we're doing this is because everything is tied up in there. We're just trying to undo a ball of yarn. We can follow what we feel. If we feel like adhesions or we feel accumulation or tension.
Or a chicken sandwich.
Yeah, chicken sandwich, right. You do have to be careful after lunch and stuff like that. True. So you're, and then you're going to kind of make the whole way around. And then some of the theory is that we're creating space. So this is kind of like getting into, the belt channel, right? It's going to be working with a few of these ancestral sinews. But this is, the belt channel's all right here. We're not getting quite down into the groin, but we're up here. So we want to create space for things to go. If anything moves, we want, like, if I'm going to sit here and hang out in the psoas, I kind of want to create a little bit of preparatory space so that if there's tension, it'll have somewhere to go. And some of the theory of this is that small intestine being the gut brain, paired with the heart, so any emotion that can't get processed in real time just kind of hangs out in the small intestine as like a little charge of contraction. So you just have all these hundreds of little contractions in the small intestine from unprocessed emotion. So that would be a way of looking at the belt channel. I've also heard Jeffrey Wynn describe Dallas abdominal massage as kind of like a low treatment. But you're kind of getting into unprocessed emotion. So whether you think of it as Zanfu, extraordinary, divergent, it's a good way to get in there. And again, I like that you're going in there with a more exploratory attitude. You don't really have an agenda. We're going to create space, see if things can move through that space. So I'm just going to verify the navel is.
Sure.
And that's a good thing to do. Like, we don't necessarily have to have the shirt up, so that's nice. It's always nice in Tuina if people don't have to disrobe, they can be more comfortable, one more, or you could have it skin on skin. And I always just want to make sure if I'm not lifting up, I want to know where, like, people are dressed and stuff like that. I kind of just want to make sure my hands aren't wandering too far that way. So with that warm up, we're going to take our two thumbs and we're going to rest them just about kind of between stomach 25 and spleen 15. And we're trying to land sort of on the edge of the psoas eventually. And again, we don't want to be in too much of a hurry, but we only have so much time in the treatment room, right? So the rhythm would be, on the inhale, push up my thumbs, and on the exhale, just let them sink in. And again, let's have them do that a few times. Push up with the breath. And I want to make a little ground every time he exhales. And again, conscious weight. We're not trying to push, but we are trying to. And then you want to hold your ground. So go ahead and breathe into my thumbs. And if he breathes in real hard, I'm going to have to start all over because it's going to push me back out.
Okay.
But you're doing good. And then I'm just going to sink in. So that's the game. So we can do this at several places on the abdomen. And once the patient figures out the learning curve, then he just goes ahead and pushes me out with this breath and tries to let me in on the exhale. Exhale. If anything hurts, let me know. Big breath. Big exhale. And you'll kind of feel that, like intestines will kind of shift out of the way and you start making your way a little bit deeper. Deep breath. And on the exhale, vision everything opening up. So we're getting pretty close to what feels like the band. The psoas is always kind of it's usually pretty ropey. I think we're still a little above it, but we're getting there. How's it feel?
Good.
one more inhale. And on the exhale, sink a little further. And then just kind of hold that for a little bit. And you can take as long as you need to with that. And I'm going to do that on the opposite side. Exhale. So again, you can't see his navel, but I'm kind of between stomach 25 and stomach 15. He breathes in, I give him a little bit of space. I sink in, and then as he breathes in, I don't let him come up as much. I hold my ground without trying to, make him feel like he can't breathe, and then I try to sink in from there. Deep breath. Breathe in. So I'm moving a little faster, and I feel like I'm going to have to give it a little time on this side. Deep breath. And anytime I feel like tension or so that I'm kind of landing on something, I just kind of wait and it'll shift out of the way. And then I will do, there's goldfish from the abdomen. So if I'm kind of pushing everything around like that, before I finish, we're using our finger pads and we're kind of aiming our chi to the spine. So it looks like I'm grabbing all his belly, which I am. My intention is grabbing the spine so that I can rock his body and kind of get his organs to decide where they want to be. And if that's too invasive, which it can feel a little bit weird, you could always finish with the feet. Like I said, these are good ways. If you're going to sort of move people's organs around, give the body a little wave to let them settle. And, all right, thank you.
Number one, all right.
And anybody want to try a little bit of the breathing technique at all?
I'll try.
Now, come on, Esther. And let's see. Good. So again, we just have our finger pads. Make sure the patient's breathing. And we're going to go, well, actually, again, I'm getting ahead of myself. We're going to start at the navel. So kidney 16. Just these clockwise circles spiraling through the abdomen. So there's a lot of, there's a lot of generalized tension in the abdomen. And it's a very vulnerable spot. So I feel like somebody allowing you to do this, as long as they're not feeling super uncomfortable about it, is a way of, being pretty vulnerable, right? Being a way of kind of letting themselves turn off some of the Wei Qi of the autonomic nervous system. And then when I've kind of gotten all the way around kind of the whole large intestine, I didn't do cat's paw, so I'm going to do a little bit of cat's paw. And then instead of the psoas release, we're going to go to the, is that right about your navel?
Right here.
Okay, thanks. So we're going to go to the navel, and we are going to just pick, be pretty much kind of like Ren 7, Ren 9, and kidney 16, really. So I'm going to start at kidney 16, but we sometimes put a bagua over the navel. So there's like 8 points around the navel. We're just going to do 4. Four of them, not do 4. But. So I'm going to use the pads of my fingers here and do the kind of the same thing we did over there. So on the inhale, lift my fingers, deep breath. And on the exhale, see if you can let my fingers sink in. And deep breath. Exhale. Deep breath. And visualize that my fingers sink closer to your spine on the exhale. And with this, we're not going all the way down to the psoas, so you can kind of look at it as soon as you feel anything shift. When you're down there, you can go further, but you can just shift to the next one. We're going to do 4 of these around the navel. So this is Ren 9. Deep breath. Exhale. But we're just kind of thinking of them as like north, south, east, and west. Breath. Any discomfort? A little bit?
It feels good. It's like a nice massage.
Okay. And I'm also going to try to hold my ground here, and then I'm going to sink down. And you can wind up, you'll feel the aorta pretty strongly sometimes, and you can end up going all the way down to the spine. But so this would be kind of a good way of releasing the rectus abdominis and kind of activating the Chong Mai. Working on the belt channel. Exhale. And one more and see if we can create a little space. And then the last one is going to be right around Ren 7, just into the navel. Breath. Exhale. And one more time. And we can also try to get in a little bit underneath the ribs here. See if I can find your intercostal border. So take a deep breath. Breathe in. So we're right underneath the intercostal border. And then on the exhale, we're going to try to go in a little bit. Sometimes this is a little easier with the thumbs. Exhale. Let me know if anything hurts. Do organs there. Deep breath. Rock the ribs a little bit if we can get under there. Sometimes you can get right up under the ribs a little bit. And when people breathe in, you let your thumbs come out, and then you can follow them in as they exhale. We'll do this other side too. Deep breath. Exhale. How's this side feel? So now we have the lip.
Not as tender as the other side,
Okay.
surprisingly.
Exhale. That's good. It means you got your liver chi in order.
Okay.
Right, and then sometimes you can get under there and shake those ribs around. So again, I would shake the person out. And let's have you face down for a second. Let me wash out your calves. All right, I was thinking of trying something. Esther, let's have you scoot down so your feet are off the table. Let's see how this goes. So this was kind of an add-on to calf gua sha that somebody just mentioned. And I was like, that makes sense to have the foot hanging off the table, and that you can, so while you're gua shaing, you can be pumping them. So you're opening up that space and can allow you to get in a little bit. And may I put some oil on you?
Yes, that's good.
And a lot of times with the ancestral sinews, they say, calves or gastrocs as well. So I don't know that we are really getting on to the soleus, would be more in the gastrocs, but I think the saying is, fight or flight begins in the calves. How's that feel?
Perfect. Oh,
And so it's not too painful?
no, it's good.
I'm trying to figure out how to rock your foot here a little better. And that kind of pumping action is too, because the soleus is also, the foot pump, or the venous supply pump. This also stretches out that muscle. Do this side. So you can generally kind of gua sha anywhere. You just have to watch out for people's, their tolerance. This side feel all right too?
Mm-hmm.
So even though we're not getting a whole lot of sha, we are addressing those calf muscles. So with that, a lot of times the ancestral sinews don't have to be the focal point of your treatment. A lot of times they'll just be an adjunct. So I'm going to put these that way. And as an adjunct, you'll see it kind of with the divergence. And you see it with like the belt channel. It's like, I'm going to do the belt channel. You should release, check these ancestral sinews, see if they need releasing, because they start opening up that whole sort of like latency mechanism, letting the body release, letting the weight she release. So some of the, the divergence will have gua shaing. I'm not quite sure if I could attach an ancestral sinew one for one with the divergence. You have like, the first confluence is the kidney and the bladder. So obviously, paraspinals come up as something if you're going to be doing the UB confluence, and then if you're doing the kidney confluence, it seems like kind of opening up a little bit of the da bow, because it includes the da bow and the belt channel around that the original belt around the kidney divergent. So the bladder and kidney divergent are kind of seen as an extension, almost like the belt channel is sort of this gateway into all these collaterals of latency. So the idea that divergents are like the collaterals of the 8 extraordinary vessels. They're the Yuan-Chi version of the lobes. So, opening up this area could still be useful because that's the belt. We also have on the liver gallbladder divergent, you have this area that could be released. I think you could always releasing the diaphragm or the SCMs, so you can kind of see which ones are sort of officially tied to them somewhere, but you can always pick one, whatever seems to be the tightest on the person. I'm just going to stimulate something in this ancestral sinew network so that the body can release. And let's see, we're 15 minutes. Let's, Graham, do you be a demonstration? Thank you, Esther. You know what about the ankles?
Yeah.
Let's have the case up, Lisa. And let's see. I want to show you a little bit of the sinew needling technique. So when we talk about the sinews, with the ancestral sinews, they're deeper. So you might consider yourself working on them through the primary channel needling of some of the points that I said, or like, the Wato Jaji at the back. But when we're thinking of the context of sinews, we're thinking of the superficial level. So we tend to be needling at, what we call the coulis between the skin and that first layer of fascia. So we have all that, that's sort of where this electrical energy of the Wei Qi circulates. So in order to not confuse the body, we like to have the needling be superficial. And the idea being that you would start on a channel, let's say I'm on the large intestine, and I would chisel down. And so one of the techniques is chiseling, which I'll show. And you're just staying just below you're staying at that coulis level, and you're going to take that down through all the Asher points. And depending on how much time you have and how many things are tender, and then you're going to do the Jing well. That would be the sort of sinews in a nutshell. So we have the Asher points that represented by touch. Where does it hurt? Honor the person's pain, and then we do that, and then we're going to get to the end, and then we want that the exit point of the Jing wells, which also represents the movement of releasing that channel. And then I guess ideally would be you've done a manual release. In the absence of these manual releases, though, like it's common at Taoist traditions clinic to moxa or needle moxa, do 4 and do 14, because the students don't always have time to do the sinew releases, and people aren't always as manually adept at them. So we open it through different ways. So acupuncturists are resourceful. We'll see what we can do with the needle. And so the chiseling stays at that level of the coulis. And what I've found from doing this and from supervising is that there are some points. Now, a purist might say that you could go down the gallbladder, Taiyang, superficial needling at GB30, and then go down, and sometimes you're like, man, I just don't know. I don't know if I have enough faith that GB30 is 4 inches deep, and my superficial needling is going to release it. So you'll probably have people with different opinions about it. So my opinion about some of these is that you're just trying not to distract the body or throw the body off. So you could do your sinew treatment and then needle GB30 afterwards. That would send a pretty clear signal. Or you can put in your primary channel points first, and we'll give you some of the pros and cons of that. So let's say you're doing, I want deep needling at GB30. I'm going to put that in. I want to retain something at the Shea cleft. So now the Shea cleft is going to open the channel, but we're going to be doing it from the primary channels. So now we're getting sophisticated. Primary channel needling on GB30, primary channel and needle on Shea cleft, and then we're going to chisel down the same way that we've said before. So you also have this idea that I really want to get into this joint. So I'm going to do Li15 primary, and then I'm going to do the Wei Qi down. So you have all sorts of different ways that you can do it, and so I feel like there's a couple things to watch out for. If for some reason you think that there's a pathogen that you are inviting to a deeper level of the body, this is kind of more about divergent thinking, then you want to be more of a purist about it. You can do your sinew treatment, but you really want to be careful. Like maybe you want to do the deep needling GB30 first, pull the needle, or not do it at all. but you can keep your message clearer. A lot of times, like with injury or some of these chronic things, it just seems like, there's so many sinews involved. This sinew seems to be the one that's out of whack. I think I have a little latitude. I don't think I'm going to translocate a pathogen. So that's also kind of one of the things that Jeffrey seems to, for his sense of responsibility for an acupuncturist, am I going to translocate a pathogen? And a lot of times, the answer is no. But occasionally the answer is like, this person still has this residual sinus thing from the external invasion. I want to do a sinew on them. I'm not going to monkey with this primary channel needling. So that's kind of the thinking that you would do. And then I feel like some of the students will get, they'll be better at orthopedic needling, better at primary channel needling. So they're kind of doing all this deeper needling, and I'm like, it works, right? Because a lot of tendinomuscular systems allow you to do that. But I feel like the beauty of the way of doing it the Cooley is that you'll tend to kind of load the channel, and then the Jing Well kind of goes, and you can feel it, and they can feel it. So in the absence of worrying about translocating a pathogen, I feel like if you're missing the signal, there'll be nothing loaded at the end. The Jing Well might be good, your needling might be good, they all get better, but you're not quite honoring the system's approach to the sinews, where you're just trying to load all that Wei Qi and have it go at the end. So there are different types of methods. I haven't used the tenting method in a long time because it requires needles that are dull. So there are some people using the sinews because if you can do the tenting where you needle counterclockwise, get the skin to come up, and then you can pull it, and you kind of make these micro tears in the fascia, heavy stimulation. You also have that releasing upward motion. So it sounds like a great technique, but you're not going to do it with like Sarins. You're not going to do it with these spring 10s that I have here. And then you're not supposed to use a needle and reinsert it in the body. But I have for some practitioners by by the fourth insertion as you go down to the needle, you might be able to tent as these needles get a little duller. So that's one. There's also a method for the Wei level, which involves just like superficial needling and doing like a clockwise circle and a clockwise circle. But to me, that doesn't have the directionality towards the Jing Well. So there's a place for it in the sinews, but I'll give you my sense of what chiseling would look like. And you also have with the sinews that you could add the confluent point. So we didn't talk about the confluent points because we weren't really talking about just we talked a little bit about them. But if I was going to do is a large intestine channel, we could do 4 and do 14, but he already had those releases earlier, so hopefully everything's still activated. And then the arm yang confluent is stomach 8, so it'd be up here, and then we're allowed to palpate. So GB13 is kind of in the general area. So you could also be like, acupuncturists I feel like are reluctant to let go of the point. Like you can just needle anywhere that's sensitive. Like, I can't, they're stomach 8 and GB13, they're there, I gotta choose one. So you are given the freedom to not do it, but if you prefer one or the other, you can. And then, so I find that, I find a 1-inch needle helps me do it. Like sometimes you can just freehand your way down, and you can do that with a 1-inch needle. So I remember trying 1/2-inch needles because they're just so easy to do. But it's so easy to come out of the skin with a 1/2-inch needle when you're needling superficially. So we had the idea. I feel like I've been talking about Life 15 so much. I got to do something with it. So the sinew needling is going to be, kind of transverse oblique. So we're just in like that. And I'm going to get it in a little bit more, but it's still transverse oblique. And then the idea being that the chisel is...
Can we get it this angle? That's okay. Hold on.
Yeah.
This is pretty good.
Want me to try to get it? So we'll show you a few things. I just started needling, so you can see how superficial it is and how transverse oblique it is.
We're going to do a different one.
Well, I also want to show, I was just watching Jeffrey say this about something. Oh, you should be able to kind of touch the needle. So if you are at the coulis, you can still see where it's raised. So through the skin, I can feel the head of the needle. So that's a sign that I stayed in the coulis. Whereas if I go deeper, you're not going to be able to feel the metal of the needle. So I don't think about that much, but I can see this one is clearly doing that. So we just went transverse oblique and then chiseling, and you can almost see the needle kind of at that transverse level. So I'm in a little, but I'm not changing the level. So now chiseling, and sometimes people, you can get a little chaotic, you can try to go in different directions. If you get too loose, the needle's just gonna come out at this sort of level. You can almost see the tip of the needle just kind of waving around at this subcutaneous. So, and you can wait. We didn't palpate before we did this, but the tissue feels pretty loose. It may have been loose before I got there. But that's kind of what you're looking for, is either the patient is like, oh, I feel this, moving down my arm, or you feel the tissue release. So there is this idea with the sinews of non-retention, but sometimes non-retention doesn't work as well, right? So sometimes you're like, I'm gonna just come back, because you don't want to just be protocolish non-retention. You want to be thinking about, did the tissue soften? But then if you just leave them all retained, you've kind of deviated a little bit from the protocol. And then chiseling, the idea that it shouldn't all be from the wrist. So these are some of the things they teach in like calligraphy. It's more of like, I think it's more of like an elbow one, or from the shoulder, I forget which one it is. But it's the idea that the Wei Chi is pretty volatile too. So it'll kind of jump up your hand. So that is something that real sensitive people notice. If I do this, I feel like I'm getting glommed. Acupuncture has that thing. So if we have if we have the wrist kind of locked a little bit, then everything is not coming up the wrist. So that's something to think about. So, because otherwise from the wrist, it's going to be, I'm not even doing it from the wrist. Yeah, I guess I'm too used to locking my wrist. You feel anything?
A slight gathering sensation in my shoulder capsule, although the needle sensation at that spot is pretty mild.
And then sometimes I have to sort of drop my shoulder to get it to come on, get some chi. But that would be the idea. And then we could leave it there to see if it releases a little bit more. So you could do this to anything that's sort of related to the ancestral sinews, anything like over the intercostals, over the paraspinals, palpate. Yeah, it seems a little tender, so I can feel that tendon. So now I'm just getting it in there. So now, and then I'm going to do a little bit of manipulation. Feel a little bit?
That I can feel, yeah. Mild, but running down that tendon.
So I went in a little, but I didn't go deep. So I'm not really breaking the coolie. If I was doing perpendicular, I wouldn't want to have as much as the needle buried. And then if we don't have a whole lot of time, we can try to go to where the binding points would be. We got shoulder, and we're going to go somewhere that feels a little gunky around here. That feels pretty good. You feel any?
Right, there we go.
Okay. And then transverse. I'm going to put the needle in just a little so it doesn't pop out. I have that little bit of transverse needling. And then I'm going to try to load. So you got a little bit there.
A little more intense, yeah.
So I could stay there, but I don't necessarily need to. And then also, since I get a little red coming up, this is kind of the leapfrog method. Is that we're seeing if letting them stay in for a second longer as we come down, but not necessarily retaining them for the whole time. And then if we were just going to skip, I'm going to go to joint. Let's see, but also I want to find something interesting there. So we want to palpate. And then I sometimes, like I said, I want to insert it a little bit so that it doesn't come out. And then I can much there? We didn't have as good of an ossuary point there.
There we go.
Okay, so we'll do that, and now we're going to take these out. And you could do kind of as many needles as you need, because you're at the Wei level. The idea is that you're not monkeying with the energetics of the primary channels or the deeper channels, so the Wei Chi is okay to move. But you could go all the way down and just keep releasing, or you can gua sha a little bit, or you could rub some liniment in as you go down. You have different ways of minimizing your needle, but you're allowed to maximize your needle count a little bit. And then everything's kind of headed towards the jing well. So we're going to come in transverse on the jing well, try to get even with it. And how's that? It hurt? Or
Yeah, felt like a jing well. But there was more of a popping sensation than usual.
And that would be kind of like, voila, mini sinew treatment. And then as you work with those things, I mean, you can embellish them. You could bleed the jing well. Like I said, bleeding the jing well isn't necessarily the protocol. But again, there's really no harm to it because you're not putting anything in the body. You're just kind of ramping up the exit for the pathogen. So how are we doing on time? 2 minutes there. All right. Well, that's kind of. I think we can just go back to the computer, and we'll see what's going on. Anybody have any questions while we were? Okay. Yeah, so those are all different ways of kind of working with the sinew channels and trying to get them incorporated into different treatments. We were talking about, loftier subject of opening up the ancestral sinews for your, for these higher-minded purposes, which is more of a qigong. And I do find that acupuncture can do those things. I don't know, doing them to others that are already doing those things, I feel like is less something I've seen from acupuncture. I mean, profound things happen from acupuncture all the time. But I do feel like if you are cultivating something on your own, acupuncture can ramp it up. And I first noticed that when I was doing, not really special stretches, but I would be in some sort of position. Let's say this would be Shui Yin, or I'm trying to get into my San Jiao. I'm doing something where I'm out feeling the, they call sinew changing. I'm stretching the sinews. No isometrics, but there's a stretch. And if I did that long enough where I'm just stretching something, if somebody put a needle in the next day in that area, it would almost immediately go to the area that I was opening the night before. And I was like, oh, this is so cool. I can pick something in my body, try to open it in my Qigong, and then needle it. I mean, it's not really a way of making money because nobody's doing that. But I did notice that it can be like that, especially when you're actively stretching a sinew. And I don't really have any specific stretches to tell you, but that seemed to work well. So somebody else is activating their own Wei Qi. They're doing like the work for you, or they're doing exercises on the sinew. They're going to feel a lot in that sinew. And I feel like it's kind of like if people are doing a lot of, Qigong in the central channel, and they're kind of feeling this sort of connection, the axis, perimeter, doing their Qigong, your 8 extraordinary vessel treatments are going to, that Chiang Mai treatment is going to be even more likely to kind of land because that person is working on it. So, and they don't always have to be working on a movement. It's kind of like picking up, meeting people where they're at. Like if they're already, like vibrating pulses is something we talk about for like the 8 extraordinary vessels as a way, and the vibrating pulses are not one of the traditional ones, kind of one of the least tangible ones, but to me it feels like if you're putting your hands on a tuning fork, but the tuning fork doesn't quite stop. You're kind of getting this hum through there, and that hum is a sign that some of this this vibrational level is activated. So that can be an invitation to work on those levels. And people can have that if they're always working on those levels. Their pulses will vibrate. We see like astrologers and psychics in the student clinic, and also like recent loss, grief, death, big life changes. Those things will all kind of get that level ramped up as an invitation to work at that level. And we don't necessarily have pulses for the sinew channels. It'll kind of go back and forth, where the idea that a lot of orthopedic practitioners won't bother with pulses. And I feel like I'll do that sometimes. If somebody's clearly, I'm going to just work on their back, they're young, they're healthy, look at their tongue, and then by the time I put them on the table, I already skipped their pulse. I'm like, not the greatest habit, because that's another one. Jeffrey doesn't say a lot of these, but one of them is like, you're lazy, you don't want to take the pulse. But he's not being real gentle. He's kind of joking. But he also, recently, the idea that if you're working orthopedics, the pulse isn't necessarily. Most people who are working on that level aren't worried about the pulses so much. But what we would say is like, well, you take the pulses to rule out something weird. Like, the pulses are so deficient. You're like, oh, this healthy young man has way less resources than he looks like he has. That's a good thing to know. Or we might want to be like, this person needs their stomach fluids tonified. So that's a big thing in the Jeffrey Ewen lineage, is this need stomach fluids to release. Anytime we're releasing, we got to have these fluids. So that's something that I've internalized in my practice too. People can drink water and things like that. And then it's also the idea, do we open up Do4, Do14 to get things happening? Lung qi deficiency won't allow things to diffuse too. But at the same time, in like the next wind of like orthopedic people don't check pulses, this Jeffrey Ewen video that I was watching not too long ago, he mentioned a couple of these. Because we all know, I don't really have a practice where like the superficial part of the pulse is going to be the fu organ, right? And the rest of the pulse is on work. But nobody really taught me like a way to make that super meaningful. Because, so sometimes if I feel certain positions, like a the liver position, it's kind of the gallbladder position, but I don't necessarily have a practice where the superficial part of the pulse means something more to me. We do have this idea that floating would be the level of the Wei Qi, the level of the sinews. So you could get floating in a pulse that might indicate a sinew, but you don't always need it, because they might not have a floating pulse and they clearly have this sinew that needs addressing. You also have the idea that if you do superficial needling along the sinew, or you do some of these sinew releases, the Wei Qi pulses, the pulses might start to float. So that's kind of a corroboration. You do the Do4 release, and you're like, now I have all these floating pulses, or I have a floating pulse. Oh, this is a feedback loop telling me that this might be able to release now, because now it's active at that release level. But you don't have to wait for it to happen, because I don't find that it's the most common thing that the sinew that needs releasing has a floating pulse. It happens. But the thing that the video was saying here from Jeffrey Ewen was that we divide the pulses into 15 beings. Anybody who's that kind of study with them kind of heard that before. 15 being occlusion, and like 1 being floating. And so then you're dividing it into, Chinese medicine is going to be thirds. So 1 through 5 is going to be that sort of weight level. 5 through 10 is the yin level, 10 through 14, 15 is that, that deeper level. So this one was the 3 beam pulses would be related to the yang sinews. So you're coming down to 3 beam, but in this, you don't get one for every, like you have the Sun pulse is going to be the Taiyang pulses. The Guan pulse is going to be the Shaoyang, and then the Chur pulse is going to be the Yang Ming. Because the Sun pulse is going to be the most superficial. That's how Taiyang is. Shaoyang is the middle, and then the Chur pulse superficial is going to be that Yang Ming. So that was kind of this 3 beam level, and you can play around with that too. That if that's a little bit harder, because I had a hard time with the sinews trying to tie Taiyang to cold, Shaoyang to damp, Yang Ming to heat, and use some of these. It just doesn't play out in my way of looking at the clinic and the patients that come in. I'm sure it does play out clinically though. And then the 6 beam pulses were Tai Yin, Shao Yin, Zhui Yin. So going from the Soon Post being Taiyin, the Guan Post being Shaoyin, and the Chur Post being Shuyin. So I just wanted to throw that out there. It's not something that I've played around with yet, but we had a couple minutes. Wanted to share something about the Sinews. So I think if nobody has any questions, we're at the end of the class, and thank you for joining me. I really honor that and appreciate that, and maybe we'll see you tomorrow. Have a wonderful evening.
Thank you.
Good to see you, Leo.
Will we receive like an email of the recording?
Nice to meet you.
Oh yeah, I don't know when those will come out.
Okay, but just don't look out.
Were you getting the emails already that were coming out?
Yeah, I think it's already.
Were you getting emails already about the links?
I was just warning myself.
Well, she might not because she got to be the demo, so maybe you need
That's
to
why
get added.
I'm trying to ask if you got them, but if you
No,
don't,
I
that's
didn't
fine.
get one.
Okay, then yes.
So we should add her.
Yeah.
Yes.
Well, thanks for coming.
Thanks a lot. I got a lot out of this. I really appreciate it.
Yeah, thank you. I always, I'm always honored that the seasoned practitioners still make their own connections of somewhere in here, there's something there.
Oh, yeah, definitely. I'll be putting it to use.
All right, well, thank you. Nice to see you.
Thanks a lot. I hate to run, but I got an hour and a half drive.
Oh, yeah. I think I'm going to run myself.
Look at me, I'm a shoe-in now.
Thanks, Shane.
I'm looking forward to it. Thank you.
Bye, Kim. It's good to see you.
All right, see you
Thanks,
later,
sister. Appreciate it.
Peter.
Have a
Have a good
wonderful
one, have a good one.
You want to hear your email?
I was going to try to get down the table just to feel some of it. Have you done some of the
E-card.
At least do four.
Yeah, I've done both of those.
CAR?
Yeah, I have a friend who's a
C-A-R-T-E-R. Yep.
That guy in the UK teaches them.
That's tradition. Yeah.
What's his name?
Thank you so much.
Tim Sullivan.
All right, you have a wonderful
Tim
weekend.
Sullivan class in New Mexico, and then came back and was like, what did you do this one?
Oh, so you got a good transmission.
I got them all. Or I got those two. But while watching you, I can see how you